less than 2 weeks from the time we spoke about it, then I find out somebody that is very close to me was actually given that diagnosis like about 2 years ago. Yes, we are all Christians. We believe in God. We believe in miracle. Pray and do what is right. You still have to follow the doctor's orders. You know, I'm very sure at the end of this presentation, our rector will surely talk to you more about that. I'm sure he listens to his doctors too. So if the rector listens to his doctors, you better listen. You know, don't let us get fooled by doing things like we are Christians. And if you don't have insurance, get one. If you are under this roof and you have no insurance, if something is going on, let us know. I'm not sure how it could happen. We may be able to help. So at this time, I'm going to give the microphone to Mrs. Oloyede to tell us why you need to take care of your kidneys. Most people have two, but some of us may have one. And don't get fooled by what is called kidney transplant. Some people may have to be in line for 5, 10 years, and it will not get to them. So please, don't get fooled by kidney transplant. Take care of your kidneys. Thank you.
As my mommy have said, we have a PowerPoint. We appreciate if it can be on there. Yes. So let me just start by telling you, kidney disease is the fastest growing non-communicable disease in U.S. 37 million of Americans have kidney failure. We have millions that is actually at a risk. That's my specialty. I've been doing it for years. I cannot even name it. And recently, we are seeing a lot of African American, especially Nigerian, visiting us. Things that can be prevented and things can be avoidable. And that's why we are here. If you need additional information, don't hesitate to reach out to me after this presentation. Thank you. I'm going to be looking at it as we are saying also is, in the most people, there are two kidneys. The kidney are located on either side of the spine, just below the ribs cage. The kidneys are about the size of a fist, and the kidney are shaped like a kidney beans. Your kidney are connected to your bladder by the two whole ureters. Also, what are the functions of the kidney, if I might ask? Think of the kidney like a pasta strainer or a filter. Your kidney keeps some of the things in your body that you need and to get away of it. So it's like a filter. Some of the stuff come out, the toxin come out of the body, and that's all the work of the kidney. The kidney also do other job that you may need. Your kidney make urine. Yes, your kidney remove the waste and extra fluid from your blood. Your kidney actually control your body chemical balance. Your kidney helps control your blood pressure. Your kidney keep the healthy bone, and your kidney also help you make a red blood cell. Awesome. So what are the risks of the kidney failure or kidney disease? Anyone can develop a kidney problem, and it's a silent killer. The only time we see people is when it's already end-stage renal disease. I repeat, if you are diabetic, if you have high blood pressure, if you have a family member with a kidney disease, and even also if you're African American, Hispanic, Native American, or also if you're over 60, please, prevention is better than cure. How to prevent our kidney disease? First of all, we already mentioned diabetes and high blood pressure are the two leading causes of kidney failure. It is very important that your blood glucose, which is a sugar, and your blood pressure are checked often by your primary doctor or by your physician also. Also, make sure you go and do your regular checkup, taking your medicine or medication as prescribed, regular exercise, low-fat diet if you can, avoid smoking, and even though if you have to drink, moderate, so minimizing. What are the tests? That's another thing. We go and do our annual checkup. We go to our doctor once in a while, annually. We don't even, they do regular one, but we need to pay attention how to check for our kidney. They do not check your kidney unless you ask, or unless something flag, they will not. So these are the reason why we give you all this information now. Many kidney disease often have no symptoms. Like I said, tests are given by physician and are the only way to find out if you have a kidney failure or disease. You can ask your doctor, check my GFR. Because sometimes like, what is GFR? Basic calculation. As long as your doctor checks for your creatinine level, they check to see whether your kidney have function. And sometimes your doctor can check your blood from for urine. Your urine test, they can check it from there. Then your doctor will pull the result from the test and actually calculate GFR. A normal GFR is supposed to be 90 to 130. 90 to 130. As you are getting older, it's increased also. Also your blood pressure. They need to make sure we manage our blood pressure, and they make sure the blood pressure range, normal blood pressure is to be 120/80. When we say 120/80, systolic, the top one supposed to be 120, and the bottom one supposed to be 80 in the end. How about your blood sugar? Diabetes. We all, so that is the most leading cause of kidney failure. Ask them to check your blood sugar, and check your blood sugar if you have diabetes. We have to be careful what we are eating to, be conscious of our body. Sometimes people are just born with the kidney disease. They have the cancer of the kidney failure. So sometimes they can do the biopsy. I've taken care of a little kid before that was born without no kidney. So sometimes it does happen in the end. So they can do the biopsy, and they can check your biopsy in there. And sometimes they can do the ultrasound to check your kidney in the end. So what are the tips? We just worry up now to keep yourself healthy. Try to lose weight if you can. Get active. I was telling my husband this morning, I said, I used to run around. I need to take more work now. Don't be mindful of the body, because sometimes the body don't let it deceive you. That is a really small body, we think we don't have any problem. We have more problem than the bigger one. But at the same time, you need to lose weight if you can. Get active. Quit smoking if you can. Get checked up. Take your medication as it's prescribed. Please take your blood pressure medication. It's one of the most preventing part of it. Take it as prescribed. If you're taking your blood pressure medication and it's not helping, talk to your doctor. They can give you more medication. They can increase its strength. Because all the non-compliant patients that we see is come to us. It's called kidney failure. Because if you are doing what you're supposed to be doing, you're not supposed to come to us. Eat food that is low in salt. So God bless us. And as you said this morning that my sister, my evangelist was talking about, we have to walk in the faith and the hope, but at the same time we have to take care of our mind. If we don't take care of our mind, the physical part of it is not we're taking care of. Everything come together. And we all know Jesus is a great physician, but we need to take care of our body. God bless you.